I made a phone call late last night. I had gotten a word yesterday that we got this great recognition, and I'm usually running pretty late in the evening, and I said, ooh, I wonder if I called her, will she be asleep? And she said she usually does go to bed early, but she was awake, and so we did have a conversation. I wanted to offer her our congratulations. Dr. Leanna Wynn, our own health commissioner, is being named the 2018 Local Health Department of the Year in this large category by the National Association of City, County Health Officials. And I think we here in Baltimore already appreciate Dr. Wynn and her work. When I think back just since I've been here, some of the initiatives and the efforts that continue to move forward. Healthy Baltimore 2020, which is a strategic blueprint outlining key priorities designed to promote health and well-being in Baltimore City. We're certainly in the Billion Step Challenge. I don't know how well you all in the health department are doing, but I do know that I've had an opportunity to participate in some of your activities, especially our senior activity. And let me see how many, what do I have today? 9,291 so far. You have really been focused on combating the opioid addiction, including issuing a blanket prescription to all residents for Noxalone. I never say it right, in 2015. We are training people how to utilize this and make it available to the citizens of Baltimore who are in great need. I think one of our greatest achievements certainly has been the Stabilization Center, a 24/7 ER for addiction. We launched this and the levels of care initiated for hospitals in the city in 2018. But let me just talk a little bit about the Stabilization Center. This is probably the first in the state of Maryland and certainly a model for the entire country. And when I think about the work that will take place there and the kind of facility that we ultimately chose, which I believe will make a difference in the lives of people in our city. The level of care was an effort that was initiated for our hospitals in our city to say, get in the game, help us help the citizens of Baltimore. We know that drug addiction is a problem. We look at it as a health issue. And with the levels of care, what we're saying to the hospitals, we will be monitoring. And more importantly, we need you to help us as we continue to combat this problem. Vision for Baltimore, which is also one of my favorite programs for our students in our classrooms, working with Johns Hopkins University and Hospital. We realize, and oftentimes we don't think about this, you know, our children get labeled because they can't see or can't read. And some folks want to say, well, maybe they've got mental issues or social issues, only to find out that if they had an opportunity to get their eyes checked, and not only that, to be able to get a pair of glasses. I wish you could have seen the smiles on those young people who got their eyeglasses for the first time. Thank you for that effort as well. And Be More for Healthy Babies, just an initiative that you've been working on for so long that has improved the health of our young people in our city since 2009, increased their care by 40% and their achievement efforts. We've been able to reduce the disparity between African Americans and white infant mortality by half, again, because of the work that you've done. And your department. As you would say, Dr. Wynn, you don't get to do this work by yourself. It is the effort of all of the people who are gathered here and those who are not here, who've worked so diligently behind a leader who understands the importance of collaboration, working together, looking ahead, having a vision, and you're truly a visionary leader for this department, one that the citizens of Baltimore sincerely appreciate. I believe this is your national award, so I get to hand this over to you again. Congratulations. But we also wanted to provide you with our own city award, a mayoral salute, and to say again, we appreciate you, we love you, we're so grateful for your dedication to the citizens of Baltimore, to this department, and for again elevating Baltimore to its highest heights. Thank you so much.
so many awards. It's hard to hold, and we don't want to break them in City Hall. There's a public health issue waiting. But I want to say thank you so much to Mayor Pugh. I mean, I look up to the mayor every day as our leader. I mean, you guide the vision of our city. You guide the vision for all of my colleagues who are agency heads. You remind us over and over again about the importance of collaboration, collaboration, collaboration. You help us to achieve our best by setting that vision, by setting the goal high, because our citizens in Baltimore, as you've said, deserve no less. They deserve that we give everything that we can, because we have this privilege of serving our residents. And I also look up to you as a personal inspiration. I mean, every time I think about health and wellness, I think about, wow, what have I done by 8 a.m.? Maybe not very much. But she's already ran, 10 miles and has worked for 4 hours or something. And so you embody health and wellness in your personal life. But Mayor Pugh, you also really understand how health is tied to everything. As you mentioned with glasses, that getting glasses for children is something that is an educational component, right? It's an educational goal. But it also very much is about health, and that health and changing and focusing on health equity can transform the landscape of our city for public safety, for education, for jobs, and everything else. And so I really want to thank you so much, and I know our team is very grateful to you and your leadership. Thank you very much, Madam Mayor.
So let me just say in your humble speech, today is about you.
No,
and it's about your department. And again, I salute you, but I also salute this department. So I give you all a big round of applause.
Thank you. And Madam Mayor, I'm so glad that you mentioned our agency. I mean, we are here today not because of me, and we're not here because of you. We're here for our health department employees who have just done such incredible work. I mean, I look at our team, and it's the team that's here who are our senior team leaders. But I also look at all the other men and women at the Baltimore City Health Department who are on the front lines every day, working to reduce disparities, delivering critical health services. I mean, our directive is broad, from animal control, restaurant inspections, seniors, disease investigation. We work closely with our hospitals, right? It really is about everything we understand as being tied to health. School health, I mean, I look around at all of our team, we have clinics in the city, we do so much that's part of our health department. And I'm just, you often say, Madam Mayor, that you have the best job in the city. Well, I compete with you in that regard. I think that I have the best job in the city because I'm just so honored to fulfill the mission of our department to improve health. And I get to work with such an incredible group of dedicated public servants every day who are working tirelessly and working with their core passion. I mean, this is a matter of passion for us to do this work for the residents of Baltimore. So I want to join you in giving our team at the Baltimore City Health Department a round of applause for their work.